Citalopram, brand name Celexa, probably one of the most common antidepressants in the world. And if you want to know all about it, then you've come to the right place. Hello and welcome. My name's Dr. Sil. I'm a junior doctor from Australia and I'm training to become a psychiatrist. I work on mental health wards, psychiatric wards, and I treat things like schizophrenia, major mood disorders like depression, bipolar illness. I also am involved in the treatment of personality disorders. I do psychotherapy. So I have a very varied role, which is really good. But knowing about medications is absolutely critical to being a good psychiatrist. And so that's why I also make these videos, because I'm interested in mental health education. And if that sounds like your cup of tea, you can consider subscribing and joining the community. All right, let's talk about citalopram. So I think we're only a minute or two into the video and I've already made a mistake. I think we call citalopram an antidepressant, and we call a lot of things antidepressants, but really the more accurate term for it is an SSRI, a selective serotonin reuptake inhibitor. And that's because when we run studies to see how these medications work, it looks like they block the reuptake pump of serotonin at those spaces between neurons, theoretically increasing the amount of serotonin in that synapse between neurons and thereby having an effect that is antidepressive. And the theory here is that it increases a chemical called BDNF, brain-derived neurotrophic factor, and that makes neural plasticity more available to forming less depressive circuits in the brain. We don't have to get into all the nitty-gritty of all the neurochemistry and the biology of how these things work because it's incompletely understood. But there's still plenty that we do understand about this medication, and so that's what I want to talk about. So yeah, let's talk about why it's used. The indications for citalopram include depression, anxiety disorders, premenstrual dysphoric disorder, obsessive compulsive disorder, panic disorder, and more specific anxiety disorders would include things like panic disorder or agoraphobia or social anxiety disorder as well. Now, we spoke about already how it works on that serotonin reuptake protein on the neuronal membrane, but it's also probably got some antihistaminergic effects as well, which put simply means it can make some people sedated. But strangely, other people don't get sleepy at all. They actually get kind of energetic off of it. And it's hard to predict who's going to have which response. But it's important to remember that people can have both responses because it'll inform when you should take the medication. And we'll talk about that later. Now, how long until it works? Well, generally with SSRIs, you want to try them for at least 2 weeks, and you start at a low dose and then you can try increasing the dose. Generally between 2 and 4 weeks, you'll start seeing the start of its effect, and between 4 and 8 weeks, you'll have its effect. If there is no effect after 8 weeks, you need to consider a dose change or a change of medications, and these decisions should be made in discussion with your doctor. Now, escitalopram can be used in combination with other medications depending on what the illness is being treated. Some people with insomnia might consider a trazodone and citalopram combination. Sometimes it's used with mirtazapine or bupropion in terms of treating for depressive symptoms. Sometimes it's used in combination with mood stabilizers if treating a suspected bipolar illness. All these things need to be decided between you and your doctor and considering the pros and cons for your individual circumstances. Now, tests required prior to starting. If you are a healthy individual otherwise, you don't need to have other blood tests before trying citalopram. I suggest everyone with a first episode of depression should get a series of tests, anxiety as well, because there are organic or physical health contributions or causes for these things. So getting a set of observations with your GP, looking for things like heart rate and blood pressure at baseline, getting things like blood tests done and an ECG. These are all really helpful things to exclude other things that could be generating anxiety. If you have a congenital heart malformation that causes palpitations, and that could theoretically present as anxiety first time. If you have high levels of thyroid hormone because of a hyperactive goiter that you don't know about in your thyroid glands, well, that can present as anxiety as a first presentation. So there are physical health things that present as anxiety, electrolyte abnormalities, nutritional deficits, iron, folate, probably vitamin B12 and vitamin D, all sorts of things can at least contribute to anxiety, and you want to optimize your general health, especially if there's any kind of mental health problem. In terms of side effects, it's similar with citalopram as it is to the other SSRIs, selective serotonin reuptake inhibitors. So there's the gastrointestinal or the gut side effects, things like nausea, diarrhea, and this is because serotonin, the chemical, is very active in the bowel and in the gut. There are serotonin receptors throughout, and so you can get a nauseous response. Some people may even vomit. So that's one domain of side effects. There's also sexual side effects, so problems with erection, ejaculation, orgasm in both men and women can be seen with SSRIs. And as we said before, there's probably an antihistamine effect. And so depending on where your antihistamine receptors are, some people might get a sedative response to citalopram, and that will guide if you should take it in the morning or at night. So some people get sedated. Other people don't get sedated at all, and they'll feel super activated and get more energy than they've had in a long time and want to go and do things. If that's the case, you shouldn't take this medication at night. There are some more rare side effects that may be more common in people who have abnormal metabolism, or renal failure, liver failure, elderly people. There's something called anyway, we don't have to go into syndrome of inappropriate antidiuretic hormone, but it's essentially a side effect where your sodium levels can get affected by the medication, and that can be diagnosed in a blood test and a urine test. In terms of weight gain, this is actually considered a relatively uncommon side effect from citalopram. SSRIs can have associated weight gain as a side effect. It can be seen, but citalopram is considered one of the less associated with weight gain. Now, if you're getting side effects, what to do? Well, first, you start at a low dose, lower the starting dose if needed, but try to, if it's not a serious side effect and it's not causing significant functional or quality of life issues, try to tolerate it, wait. They usually abate. Most side effects will get less intense and even sometimes disappear as your body gets used to the medication. I guess it can be considered a side effect, but as I was saying, it can be kind of activating, and people can get energetic and kind of more restless. That can manifest as anxiety, and actually, if there's suicidal thinking, it can worsen suicidal ideation as there's an increase in energy. And so if that's the case, that can be, well, first of all, you need to talk to your doctor about all the side effects you're experiencing. These different side effects can be managed with different strategies. There are some medication options for some side effects. So if there's anxiety associated with starting the SSRI, you can consider short-term use of benzodiazepines. That needs to be discussed with your doctor to see if you're an appropriate candidate. Then there's also things like sexual side effects can be treated with sildenafil or Viagra. That's done sometimes. If there's insomnia, sometimes a low dose of mirtazapine can help, which is another antidepressant, but it works differently to an SSRI and can have an additive antidepressant effect as well. But it's important to remember that side effects are generally dose dependent. So starting at a lower dose and slowly increasing the dose can often help with the side effects. All right, now talking about dosing. So the range is usually between 20 and 60 milligrams a day. It's usually taken in one dose, and it can be either in the morning or at night, depending on if it has a sedating effect on you, or no effect on you, or an activating effect on you. But here's the hot tip. To save money, usually the tablets come with a scored tablet, so you can break them in half, and the cost difference between a 20 milligram tablet, a 40 milligram tablet, and a 60 milligram tablet is generally not much at all. They're usually roughly priced the exact same. So if you are on 10 milligrams, I suggest getting a script for 20 milligrams and breaking them in half, and you get twice the medication for the same price. And the same goes for 60 milligram tablet if you want to break it in half and have 30 milligrams. So just think about that with your doctor, and it can hopefully save you a bit of cash. Now, in terms of long-term use, it's considered safe. In terms of like habit forming or dependency or tolerance, it's considered safe. If you do want to stop, I always suggest a taper, and a slow taper at that, just to avoid SSRI discontinuation syndrome, which is this rebound anxiety that can happen with people who stop serotonergic medications. And This textbook that I'm using to reference this talk suggests 3 days at 50% of the original dose and then another 3 days at 50% of that dose. I would slow that even down further. Talk to your doctor about what works for you, but I wouldn't rush it. Now, in terms of drug interactions, there are significant and important drug interactions to know about. The main one is with monoamine oxidase inhibitors, which is a class of medication also used in depression management. Things like meclobamide and phenelzine. These medications are pretty strong antidepressants, so you will probably have been told about the side effects and the risks of changing antidepressants if you've started on these drugs. But the important thing is to make sure there's 3 weeks gap after stopping a monoamine oxidase inhibitor, an MAOI, before starting an SSRI. So taking an MAOI and an SSRI at the same time is essentially never, or very, very rarely done, and only done by people with significant expertise in the area with very close monitoring. So if that's happening, I'm sure you're talking to your doctor about it very frequently, but otherwise I wouldn't risk it. And the reason is because the MAOI blocks the protein enzyme that breaks down serotonin. So if you block the breakdown of serotonin plus you block the reuptake of serotonin using the SSRI and the MAOI, then you've just got this huge surplus of serotonin. You're bathed in it, and what can happen is something called a serotonin syndrome, which makes people look. I've seen serotonin syndrome, and it's very scary. People look sweaty. They have autonomic instability, so their heart rate's through the roof and the blood pressure going up and down, and they're sweating and the pupils are dilated. You get confusion, and it's a really horrible. People feel extremely nauseous. So it's all the side effects of serotonin put on 1,000 times worse. So it needs to be avoided, and talk to your doctor if there's multiple serotonin acting medications. Now, in terms of special populations, so for people who have renal impairment or poor kidney function, it usually doesn't require a significant dose change if it's mild or moderate. If it's severe renal impairment, then you might have to try a lower dose. With liver impairment, the dose will usually be around 20 milligrams and sometimes up to 40, but rarely would it ever go up to 60, so it's usually a lower dose range. In the elderly as well, it's used at a lower dose range just because the metabolic rate is slowed. And with children, I won't even comment on dose ranges. It has to be done with a specialist, especially under the age of 12. SSRIs need to be done with a consultant, a specialist, yeah. And in pregnancy, it's a risk category C, which means there are some animal studies that show adverse effects, but no human trials, which, this is so frustrating, but part of the complexity of healthcare that we just don't have the data to suggest whether it's safe or not in pregnancy, which is really important, but it's just there's no ethical way to collect that data. So you have to basically weigh up the risks of the medication versus the risks of not taking any medication. And so the severity of the illness needs to be taken into account. So someone who stops eating when they're depressed and becomes bedridden and suicidal, that's obviously extremely high risk and needs treatment. And so you have to weigh the risks of a depressive relapse or whatever the indication you're taking it for, the risks of a relapse of mental illness versus the side effects of the medication. But there have been some studies that are not very strong studies. These are suggested that SSRIs can cause some heart defects in fetuses, that it can affect the circulation around the lungs, and also in breastfeeding. So some of the drug is found in the mother's breast milk. It's really important to remember that pregnancy and the postpartum period after pregnancy is a super high risk for mothers for developing mental illness. So the treatment is really important. So I just really encourage you guys to talk to your doctors and have strong monitoring if you're in that population group. All right, citalopram, that's it. We've done it. There's nothing else I really wanted to talk about. If you have any questions, leave them in the comments below and I'll try and answer as many as I can. And if you've had an experience on citalopram, comment down below what your experience was like, positive and negative. It's all useful reading for people. And yeah, I'll see you all in the next video. But if you find this stuff helpful and you want to support my channel, please consider subscribing and liking the video. Other than that, sorry about that. Other than that, I wish you all a beautiful day, and I'll see you all in the next video. Bye for now.